Hi, welcome to the last lecture of the semester. In this lecture, we're going to cover chapter 16, which is on therapy and treatment. So we're going to talk about the different types of treatment that there are: psychoanalysis, behavioral, cognitive behavioral, humanistic, biomedical, as well as some of the treatment modalities or ways that therapy can be delivered, such as individual, couples, or group therapy. So if you look at these types of treatment, you'll see that um, they more or less correspond to the different theoretical orientations that we were looking at, and the different paradigms of thinking about psychology. So it makes sense that each one of these branches of psychology that's trying to understand the human psyche its own way has its own methods of trying to fix the human psyche. So the types of treatment in general, there's psychotherapy and there's biomedical therapy. Psychotherapy's main aim is to try to change behavior, and I would say thoughts as well, or to help the person gain insight into their behavior, into their emotions. So they employ various types of methods and techniques in order to do this. Each orientation has its own way of doing it. So an example could be like psychoanalysis, which would be coming from the Freudian perspective. There's also biomedical therapy. So this doesn't just include medication, it also includes medical procedures like surgery or things like that are not often done anymore, but in the history of psychology, we do find examples of lobotomies and uh, different treatments like that. And some of those are still, for certain reasons, performed. You can also combine more than one therapy, combine biomedical therapies, typically medication, with some kind of psychotherapy. So this is considered the eclectic approach. Eclectic therapists will provide whatever techniques or methods they feel are going to be useful for a particular client, and they'll draw from many different orientations. And lastly, we would have what I would consider to be a newer model that's being developed now, and that would be psychedelic-based treatments. So these kinds of treatments are combining native or shamanistic type practices uh, and traditions that involve psychedelic substances with Western approaches or therapies that would be found in Western psychology. So we saw a video of this in the Johns Hopkins research earlier in the semester. So what types of psychotherapies are there? Well, as I mentioned, there is an approach for pretty much for every type of psychological perspective that we covered. So psychoanalysis, that comes from the Freudian perspective, and here the goal is to try to uncover unconscious conflicts and unconscious motivations that are affecting our behavior. And uh, often they have to do with things that happened to us when we were kids. So childhood traumas, perhaps the way that we were raised, things like that. The behavioral approach is to try to reverse maladaptive behaviors through principles that are found in classical and operant conditioning. So the idea is that since what we are, all of our behaviors were learned through our environment, well, then we can unlearn them also, applying the same principles of conditioning. In the cognitive approach to therapy, the goal is to correct maladaptive thinking and to teach the person new thinking patterns. So the belief is that the way that we think and the way that we're interpreting things that are happening to us through our thinking, that's what determines the way that we feel and the behaviors that we take. So the focus is to change those thought patterns. The cognitive behavioral approach is, in short, a combination of the cognitive approach and the behavioral approach. So it's taking the framework of cognitive therapy, but also including components that are the behavioral, that are targeting behaviors as well. And then we also have the humanistic type of psychotherapy. So here, the whole point is to help the human being, help the individual reach their potential and develop themselves, become self-actualized. And you do this through like giving them unconditional positive regard and various other things which we'll talk about in a little bit. So in psychoanalysis, the idea is that repressed impulses plus the trauma that we experience in childhood is what leads to neurosis or these states of anxiety and depression and mental dysfunction. So psychoanalysis is trying to uncover unburied feelings and conflicts that we have, and can actually take years to get to that point, to dig deep enough. Well, an important part of this process is what is called transference. So during transference, the patient is directing the unconscious material to the therapist. So they're basically relating to the therapist in the way that they would be relating to the person that is the object of a lot of their neurosis or the situations that have to do with that. So they'll project this onto the therapist, and then the therapist can then actually use that and try to help the person work through their issues. So they can employ a lot of different methods or techniques. One of them is free association, and this is just simply having the patient lie there on the couch and just say what comes to their mind. This is supposed to be a good way of enabling them to get past their ego defenses. They can also do dream analysis. So this is interpreting, the symbols and a lot of the ideas that are being explored and the narratives that are being discovered in the dreams. So this term psychodynamic comes from thermodynamics. So Freud's ideas of therapy and of the psyche were really influenced by the ideas in physics of thermodynamics, where energy is neither created nor destroyed. Um, so he felt that we had these psychological energies, right? Like these impulses and the id, the ego, the superego, and he was sort of modeling that after physics. And so the idea is um, that things can get clogged, right? Like there could be blockages within a person, and the whole point is to kind of unblock those things. So there is a lot of the therapies that came after Freud are considered psychodynamic therapies, and they have that name because of that connection to physics. An example of psychodynamic therapy of a psychodynamic therapy is play therapy. So this is typically used with children, and uh, they just have the kids play, and the kids play out their hopes, their fantasies, any traumas that they've experienced. They kind of sort of expose those through the way that they play with the toys and such. So the therapist is just understanding and try to under the roots of whatever the issues may be with the kid. So it could be directive or non-directive. So in a directive play setting, the therapist is going to actually set some structure to the play. They're going to guide the children to perhaps play with the toys in a certain way. They might suggest topics or ask questions, and they'll and actually involve themselves in the play as well. Or it could be non-directive. They could just let the kid play and then just observe and see what comes out. So let's talk about some behavior therapies. So these therapies are based on classical conditioning. So you could counter condition. So this is creating new responses um, to whatever that stimulus is that is leading to the dysfunctional behavior, right? So something is stimulating a bad way of behaving, right? So what is that thing? So they can counter condition that, right? So they can teach new ways of responding to that thing. So one example of a therapy is aversive conditioning. So this is when you're pairing an unpleasant stimulus like a shock or something like nausea, bad taste, things like that with the unwanted behavior. So perhaps you've heard of antabuse. So that's a treatment that is given to alcoholics. So they're pairing their drinking behavior with something that's really unpleasant, so that then later the drinking behavior itself creates that unpleasant sensation that changes their behavior. There's also exposure therapy. So exposure therapy is literally just presenting the individual in the situation that is causing their misbehavior, and usually like until they get used to it. That's essentially what's happening here. So this is used a lot to treat phobias. One example is systematic desensitization. So this kind of therapy specifically will pair gradual exposure to the feared stimulus with by pairing it with a relaxed state. So the patient learns how to relax their body through various methods like meditation and breathing, and then they'll kind of learn to gauge their level of anxiety and make note of that, and they begin to expose themselves to the thing that they fear, and they're able to maintain a body state that's calm within that situation. And there's another example of that too, which is uses technology, and that's virtual reality. So you can use virtual reality to expose people to those situations and help them that way as well. Principles of operant conditioning can also be used. So you're just simply using rewards and punishments to shape behavior. One example is ABA therapy or applied behavior analysis. This is typically used with autistic kids. So with ABA therapy, the the therapist will keep a very close eye on the child's behavior. They'll determine what motivates the student and what are some appropriate reinforcers to use with them. They'll try to figure out what is sustaining a particular behavior. Typically, it's a behavior that people want to change, right? The teachers or parents want to change, and they want to figure out what is causing the behavior, how is it being sustained, and how can they manage it. So they try to modify the behavior using rewards. Token economy is exchanging tokens for good behavior. And these tokens are then later able to be exchanged for other things, goods like food. So they're typically used with special populations. They can be used in prisons or special education classrooms or psychiatric hospitals. But it's similar. It's just simply rewarding a certain behavior to shape it in a certain direction. Cognitive therapy is, as I mentioned, the idea that our thoughts are what lead to the way that we feel and the actions that we take. So distorted thinking can lead to distress. So there's many different types of distorted thinking. One example is overgeneralization. So for instance, Ray may have failed a certain test. So then he thinks that he's worthless, right? Because he feels that just because he did bad in one thing, that generalizes to his entire person, right? So there's a lot of kind of thinking patterns that we have that we're not really that aware of. So the therapist is trying to get at the heart of our thinking and trying to help us correct that thinking by identifying dysfunctional thoughts and helping us replace negative thoughts with positive ones, or with better or more adaptive ones or more realistic ones. Cognitive behavioral therapy is taking that framework. So we're looking at changing cognitive distortions and maladaptive behavior. So some more examples of cognitive distortions are all or nothing thinking. And that's when you see everything as black and white. That that test went excellent, or really sucked, or uh, you know you're just seeing everything as either really good or really bad. And the reality is that in life, there's things that are in between, right? Things are not necessarily just all good or all bad. Another cognitive distortion is simply jumping to conclusions. So maybe like assuming that people are thinking negatively of you based on a look they gave you or something like that. And that's, you don't know that. That's not something you're not privy to what other people are thinking. Personalizing is another maladaptive thought pattern. So taking things personally. So sometimes people, you might have felt slighted by somebody and they weren't even thinking about it. They weren't even personally trying to attack you or anything. This would be a maladaptive way of interpreting reality that would lead you to behaviors that probably aren't good or maybe antagonistic, or and it would be based on just not really uh, seeing the world correctly. So with cognitive behavioral therapy, you're also going to be given homework assignments that have to do with behavior, with changing your behavior. So you're going to learn new behaviors, and then you're going to practice new behaviors that are more adaptive. So cognitive behavioral therapy is attacking both angles. Cognitive therapy is just the thinking and kind of goes deeper on the thinking or why a person thinks that way. In that sense, that it kind of can become a little bit more like psychoanalysis. The cognitive behavioral therapy is more direct and more specific to a behavior that a person wants to change. Humanistic therapy is trying to help a person achieve self-acceptance, self-awareness, uh, reach their full potential, but it's not focused so much on unconscious material. It's focused on the now. It's focused on what one is feeling and experiencing now in life. Carl Rogers, who was a part of this movement, actually pioneered uh, therapy and therapy approaches and even research in therapy. He developed his own method, which is called Rogerian or client-centered therapy. In client-centered therapy, the uh, the therapist is to actively listen. So this is the therapist is not really telling the client what to do or what's wrong with them or anything like that. They're listening in a way that is acknowledging the person that they're actually listening. And when they're speaking, they're really only perhaps restating what the individual said and maybe trying to clarify it. This process itself is good for the client when they kind of have to think about what they're really saying or what they really mean. And the therapist is really just kind of trying to help them uh, gain understanding of themselves. So this is a non-directive therapy. The the therapist is not trying to get to anywhere. It's not trying to reach a kind of a goal. They're not trying to interpret or give advice. They're just trying to help the client understand themselves. They do this by giving unconditional positive regard, not judging them, showing genuineness, empathy, and acceptance towards the client. So biomedical therapies, as I mentioned before, um, they're either biologically based, like surgeries or treatments or medications. So an example of a biological based treatment that isn't a medication would be ECT or electroconvulsive therapy. So this is when you're inducing through electricity, mini seizures in a person. So this is a treatment like this obviously could only be used in extreme cases, and it's particularly effective in extreme cases of clinical depression. So this is when where people they won't get out of bed, they're not going to feed themselves, they're not going to take any action in any way, shape, or form. So it's been shown to be 85%, shown an 85% improvement, but it does have problems with it. One of them is that it can cause memory loss. So it should obviously, treatments like this are only used in the most extreme of cases. Psychotropic medications, we talked about this when we covered chapter 3. So this is altering the various levels of neurotransmitters or chemicals in the brain. Um, so these only treat the symptoms and they're not necessarily dealing with the heart of it, whatever the issue is. So taking medications could either be a short-term thing or it could be a long-term thing like it is in conditions like schizophrenia. So they can be used alone or in combination with psychotherapy. So in combination is typically better. You're really kind of trying to wean people off of any kind of medication. You may give it to them initially to help them if it helps them, but also you want to do psychotherapy with it as well. Lastly, we have psychedelic therapies. So psychedelic therapies are a combination of traditional or shamanic practices with Western psychology. Um, you can think of these as being theoretically similar to the perspectives found in psychoanalysis, particular, particularly those of Carl Jung, who talked about the personal and collective unconscious. But a lot of the ideas are also kind of coming from the native and shamanic traditions as well. For instance, the use of music. A lot of psychedelic assistance therapies will use music as part of the process. And shamanic traditions also are heavily reliant on music and really controlling the person's experiences through the different vibrations that various instruments can create. Um, that's also the reason why a lot of people in the 60s really like to listen to music and while tripping on these drugs because it magnifies the our sensations of the waves as well as um, things that you can experience that are being uh, stimulated by the waves themselves. So this term of psychodynamic really kind of comes into play for these kinds of therapies. So these sorts of therapies, I see them as working as like a psychological flush or a purge, a psychological purge, or an unclogging of the psyche. Ayahuasca specifically is literally a purge. So people are literally purging and vomiting during these ceremonies, and the shamans that run these, or at least the ones that I spoke to, specifically said that the purpose of the ceremony and the process is just to purge. Whether it's physical purging, whether it's vomiting, whether it's some kind of diarrhea or something like that, or crying, or just letting out emotions, it's to purge, to once again unblock these energies that are in our psyche, to create a flow with our psychological drives and energies. So similar to psychoanalysis, it's about exploring the unconscious, but the difference here is that you can explore the unconscious while being conscious through these substances, and you can work through issues in that sense. Um, so, which therapy is best? The American Psychological Association identified three factors that are important for therapy to work. So one of them is evidence-based treatment. So these therapies have to have some kind of research backing their effectiveness. Also, the expertise or level of the psychologist or therapist, their abilities, their skills are also important, as well as the client characteristics, the values and the culture that the client comes from. And I would even say that the dynamic between the psychologist and the client is really important. So it's important to find a therapist that works well with you, that matches well with you. So studies have shown that psychotherapy can be effective. For instance, when it comes to cognitive behavioral therapy, it was shown that when it comes to depression, cognitive behavioral therapy was 43% effective, and medications were 50% effective, and the placebo was 25% effective. So CBT and medications were pretty similar. I'm not sure if the 43 and the 50 are significantly different from each other, but they're clearly much better than the placebo. But a placebo will work too. So um, the placebo effect, right? The power of the mind. Psychodynamic therapies have been shown to be as effective as cognitive behavioral therapies at treating the same sorts of pathologies. And lastly, no therapy is truly better than any other. It just depends on what the situation is, what the condition is for the person. Um, and It's even been shown that simply having a friend or someone to talk to can be really effective, given that they're giving showing you empathy and actually listening and helping you clarify things. So, what does the intake process look like if somebody were to seek therapy? So typically, a person goes and meets with the therapist, and their needs are assessed. They see what problems the person is having. They try to identify whether there are support systems that can help in the process, and then they'll discuss business like fees, how long the treatment is going to take, what treatment, what is it going to look like. Um, it's important that the client understands that there's confidentiality involved. So the therapist, they're not gonna, they're bound by law to be uh, to keep to not speak about your situation to anyone professionally. Individual therapy is typically, or it is just one to one. It could be weekly, or it could maybe be a couple times a month. Typically, less from 45 minutes to an hour. And really, what they do is just implement whatever therapy um, was, best or decided on. There's also group therapy. So in group therapy, uh, people who have the same problem or similar problems will all meet. So there's a lot of benefits to the situation. One of them is that people don't feel alone in having the condition or the maladaptive behavior that they have. They can gain support from people who are experiencing the same kinds of things that they're experiencing, but they can even use it to confront each other. So during the process, they might confront each other about some of their behavior patterns that are leading to dysfunction. There's also limitations, of course. So one of them could be that people may be afraid to share about themselves. There could be personality clashes, or there could be breaches of confidentiality. So not likely from the therapist, but from other group members. So as far as the group process goes, it could focus on one person per week, or maybe per week they'll focus on a couple of people, or it could be based on some kind of theme that they all experienced and they all kind of contribute. So there could be groups that are open and groups that are closed. Closed membership groups, nobody is allowed to join once the group has already been established. And the group process could include planned activities, or it can include more of a, like free form, thinking, free association type activities as well. And lastly, we have couples therapy and family therapy. Couples therapy is for people a couple, whether they're dating or married or engaged. Cognitive behavioral therapy is often used here. So couples will learn how to listen to each other, how to argue in more productive ways, and how to express themselves and their feelings. And the goal is either going to be to help them improve their relationships, or maybe to separate in the most efficient, most amicable way. Family therapy can involve one or more families, and there are many different types of approaches to it. One of them is the systems approach. So here, the systems approach views a family as an organization, and each person is a contributing member of this organization, and it contributes to some part of the process. And the process overall is shaping people's behavior. So a family therapist will help identify issues relating to this dynamic. Um, okay, so that's the end of the lecture. At the end of the slide notes, which are available on Canvas, you can find a number of videos that you might find helpful for furthering your research for the project, or if you just simply wanted to learn more about some of these topics, there's videos in the remaining slides on psychoanalysis, behavior therapy, specifically aversion therapy for alcoholics, behavior therapy, systematic desensitization for a woman who had a phobia of clowns, behavior therapy, where a person is treating his PTSD with virtual reality. There's also a discussion, an example on cognitive therapy, a video that's informative about cognitive behavioral therapy. There is an example of humanistic therapy being performed by Carl Rogers himself. And lastly, I have a video which is an interview with a doctor about psychedelic assisted therapy. So feel free to look through some of those. As you can see here, there's a number of videos that I've included here. They're in the back of the notes. All right, so that's it for the lecture. Um, See you in class.